watching CBS 2 News in high definition.
Plus, an amazing development in surgery. The new procedure by doctors that starts by making your body glow in the dark.
And an amazing development in surgery has doctors excited and patients relieved.
Yes, it's a way for surgeons to tell what's a tumor and what's normal, healthy tissue. CBS 2's Dr. Max Gomez says it's about making parts of your body glow in the dark.
That's right, Christine. You know, it's a common dilemma for surgeons. You want to take out all of a tumor or cancer and leave normal tissue untouched. But tumors don't have little signs on them telling the doctor they're bad, so it's often a judgment call. But now there's a way to tell by whether or not they glow.
It was very, very frightening for me to think that I could possibly lose both kidneys.
And that's what Linda Haywood was facing. An ultrasound for an unrelated problem showed that Haywood had 7 or 8 tumors in each of her kidneys. Untreated, they could become cancerous.
I have 2 small children, a 7-year-old and a 10-year-old, and it was very frightening.
Haywood was referred to Dr. Michael Stiflelman at the NYU Langone Medical Center, who said the hard part isn't removing the tumors, it's making sure
we don't affect the normal kidney, either by taking out too much tumor or stopping the blood flow to the kidney for long enough where it could actually cause damage to the kidney.
Turns out the best way to do all of that is to look at blood flow using a special dye called ICG that gets picked up by blood vessels and perfuses organs. When a special laser is shined on the kidney, areas with good blood flow turn into a tiny green lantern. For Haywood, this was all done robotically. When Dr. Stiflelman clamped tiny arteries in the kidney, the green glow showed him when a tumor wasn't getting blood.
In certain tumors, it doesn't pick up the ICG. It doesn't pick up this molecule, so we can tell what the normal kidney is because that has good blood flow to it, and where that tumor is, it may stay dark, and it may help us differentiate normal from abnormal.
Haywood had about 14 tumors removed this way, and not only is her kidney function normal, just 2 weeks later,
I was back to my regular routine, everyday life, you know, chasing the kids around, back to work.
Now, while the glowing technique started out in kidney surgery, doctors say it can be used in many procedures, such as putting parts of the colon or ureters together, or in finding and removing all traces of endometriosis. Pretty much wherever surgeons need to tell good blood flow from poor. Christine?
Really interesting, Dr. Max. Thank you.